Hey everybody. Yes, we're back again on MITech TV. This one we have the cyber twins here joining us, Richard Stiennon and Dan Lohrmann. They're going to be talking about, well, they were at the RSA convention last week, and I was tracking them on Facebook and seeing all the interesting stuff they were up to. But there was something a little closer to home we're going to deal with first, the Ascension hack. Now, Matt, we were just talking before we started. Why don't you set that up, talk about how that's impacted you guys at Lawrence Tech?
Well, Ascension Health is our healthcare partner for our nursing program and some other things too, but mostly the nursing program was affected by this. And they became aware, as far as I know, a week before last, that something was going on. And they basically shut all of their IT systems down and advised their suppliers and customers to basically cut all IT ties to them. And last I heard from some of the people in our healthcare programs, Ascension is, I mean, they're still providing emergency care. They're still providing scheduled surgeries that are, critical, but they put off some elective non-emergency surgeries. And they're basically, it's back to the 80s. They're doing everything on paper again.
Hmm.
But I haven't been able to get out of anyone. And frankly, the people doing frontline healthcare don't know, don't care, because they're concerned about healthcare. They don't know exactly what happened or what systems were affected or how. So I was hoping to ask Richard and Dan for a little information on that and how this happened and who we think the bad actors are.
Well, there you go. Whoever wants to take that first.
All I know is that they are attributing it to ransomware.
Yep.
So classic. And that they're asking people to bring write down their personal health histories because the MyChart system's not working. So it hit the website that they use for maintaining that. And it sounds, almost as bad as the one against United Health, but probably not with such wide-ranging impact because I don't know if it's affected the payment services that United Health incident in February had.
Yeah, I would just add, I mean, a couple things that there's a ton of information on this online right now, but the scope, 140 hospitals in 19 states, pretty much hit their entire system nationwide. Reports from St. Louis, Florida, certainly Michigan, etc. CNN was citing 4 sources over the weekend saying that it was Black Basta affiliates, which is Russian, that have impacted over 500 organizations.
Good surprise face there, Matt.
Yeah, Russia, of course.
Oh
Big
my
surprise
goodness, the
there.
Russians. Yes, go ahead.
500 organizations around the world have been hit. The numbers are really scary, and I think before we even talk about the ransomware and that aspect of it, the technology of it, what I was most shocked with is some of these quotes from the hospitals and some of the different stories. Like people going back said, I quote this one person, caused the biggest chaos. The nurse said it's a big safety concern for all the RNs to have the physicians write out the orders. At least half the staff in surgery residents have never written paper orders before. I literally had to show a resident what an order form is and what to do with it.
Wow.
I mean, lots and lots of stories like that. One person had a blood test. Just more. There's tons of stories out on the internet. You could read about these, but people had to go back 4 times because they kept getting it wrong, and they finally gave up and just went to their local urgent care and said this isn't working, and they just gave up. But ambulances being redirected, it is absolutely impacting care. So it's not just. I mean, I partially agree with you. I think probably the impact from the change issue is broader, Richard, but where I may say this may be equally, we'll see, time will tell, equally or in some ways worse, is this definitely is impacting care. Now, I'm not saying the other change healthcare did not. It certainly impacted prescriptions. It certainly impacted a lot of people as well, and payments and those kinds of things. But it looks like this is really, in many ways, shut down procedures, caused people to be redirected to different hospitals, chains, and is just basically send them back to the, I think, dark ages, but 30 years. I mean, send them back to, and just really paper and pencil, not using their computers. And it's pretty scary. I think two of the quick points I'll make, to have a discussion about it, but, a lot of discussion around, why weren't they prepared? I've read all the number of different reports that Mandiant was called in for response, which is now a division of Google. Kevin Mandia and the Mandiant organization were part of FireEye. They then, they split off and were independent, and they were acquired by Google. So they're kind of in the industry known as one of the top, if not the top, responders after major ransomware attacks. They're not saying whether they paid the ransom or not. A lot of questions. I'm sure we'll be back in a month, Mike, and talk about, did they pay the ransom or didn't they? But we did hear, with the change with United Health, they did pay the $22 million ransom, got a lot of blowback. And there's a lot of speculation online around, well, the fact that United Health paid that $22 million ransom just kind of whet the appetite of all the ransomware gangs, and now they're doubling down their efforts. So these are certainly huge issues for hospitals, and we've had a record number of attacks since February. This year, we're breaking all records, and this is my last point here. One Cyball, which is basically a threat intelligence company, said 105 ransomware attacks since February globally. 77 hospital systems have been hit in the USA since February of this year. So those are big numbers.
Yeah, those are huge. And, whenever I hear these, I think of, what it would mean if they were to practice resiliency, which is a big word nowadays. And being able to fall back to written records and written orders is fantastic, right? That you should have a plan to do that. And all new hires should be trained to write an order so they're familiar with it. You're not teaching them from day one. But, there are a whole bunch of steps between that, going back to the dark ages before computers and what you could do, right? Because you could have like immutable backups that you're really good at backing up, and you could test those backups. And I'm sure at the state and at many organizations you deal with, Dan, that, they've been doing that forever, right? Since they had MIS systems. So it does paint a picture, and I think it's just endemic to our hospital systems, right? Because we had those massive waves of acquisitions and consolidation where hospital systems would get acquired into one, like Ascension and whatever Beaumont's now called. And that means they're going to have disparate systems, right? And they don't necessarily have a CISO who's got the power to say, hey, we're going to do backups everywhere and do it the same way and all the rest. So, and sometimes that's actually a good defense against ransomware, right? If you got different systems, they might not get infected, but they probably got, strive to get to the point where all the systems work together without securing them. And that's obviously a problem.
And just a real quick aside, I wanted you to tell folks, what's the most common way for ransomware to get in?
You'd be surprised. It's actually remote desktops. They just find them and go in. It was at 87%. It's fallen down to about 60%. But every one of these big cases, it's always phishing emails, right, Dan?
It usually is phishing. I was going to say phishing. Yeah. I agree with Richard. And I think, MFA they were saying that, they were not using multi-factor authentication for the United Health one. They were blaming it on that. We don't know what caused this particular one, but phishing, getting credentials, getting someone's credentials, accessing the systems, and then once they're in, getting a foothold, and then spreading that, going sideways, is huge. And it's on and on and on. There's basically having good cyber hygiene and really enforcing that across your system is the best defense.